Good morning, Yate, and welcome to the third Fort Defiance Cancer Conference of the Navajo Nation. Now we have over 300 people who have come together to help us collaborate and network on behalf of cancer patients and families on the Navajo Nation.
In looking at cancer and looking at this disease, there's a very important area that we all need to become aware of, and that is talking. We need to talk about cancer.
My name is Wilfred Begay, and my main concern here is that I have relatives that have passed away by way of cancer.
My dad had gastric cancer, so it took his life. I hope they find a cure for this dreaded disease.
My name is Phyllis King, and I'm a breast cancer survivor. So far, it's been 2 wonderful years, and I know getting it out to my natives in my community and letting them know that they can survive cancer is one of the greatest blessings that anybody can go back and teach among their natives.
I'm Mary Dokes, and I am with Susan G. Komen for the Cure, and I'm here at the Arizona Myeloma Network's Breast Cancer Awareness on the Navajo Reservation. And Susan G. Komen for the Cure has been very fortunate to be partnering with Myeloma Network to give a grant for the breast cancer awareness program on the reservation, which really gets the information about breast health awareness and breast cancer out to women through women on the Navajo Reservation.
My name is Laura Bauer Granberry. I'm Director of National Initiatives for the Rosalind Carter Institute for Caregiving.
What differences have you seen in this event since you first attended?
I think it's an amazing difference. There's a lot more participation from the Navajo Nation.
This year, I'm finding it's a little more advanced along the sense that we are advancing into a lot more details about actually what the people themselves can advocate for themselves.
The resources that have stepped up has just been tremendous.
The numbers have grown and the interest level has grown. The representatives coming in from the various organizations, there are more of them, so it's really amazing to watch it grow.
It's very exciting that we now have caregivers programs, breast cancer programs, and also have the wonderful resources of the John Wayne Cancer Foundation, Komen, and others.
Well, my name is Diane Kelly, and my husband's name is Charlie. We're both in the music business in Nashville. So in May of 2008, I was completely healthy, no problems, no nothing. And I just put my hand up to my neck, but I just had a lump in my neck. And I just put my hand in my neck. It's like, oh, well, that's bizarre. And I'm the type of person, if I see something that's wrong and out of place and not there, I'm at the doctor. And because that wasn't right. And it turned out to be not researched that so many, we went through chemo and radiation and 6 months of that. And after the first treatment, that big massive lump went down to nothing. 1 treatment. I still had to take the 7 others. And thankfully, I made it to the other side. Had a few hiccups along the way. You know, it's otherwise it would be called a cold instead of cancer. You know, and then 3 weeks after I finished my radiation, his story starts.
3 weeks after she finished the last treatment is when I was diagnosed with colon cancer. And the thing about my diagnosis was that, honestly, it was a voluntary thing for me. My mother had had some polyps removed when she was in her 70s, which was not that uncommon. And I had been talking to my general physician, but that's one of our things is together is kind of knowing your body, especially for her. If you feel like something's not right, make them check it out. It's your body and it's your life, and you're paying them, so you're hiring them. So they're supposed to do what you want them to do, right? That's how it works. So don't be shy with any kind of discomforts or anything like that you're having. Make them check you out. But I think in this instance, especially with cancer, you need to know that there is hope. There is always hope.
If you had one thing you wanted people to take home from this conference, what would it be?
Reach out and open yourself up. Let people help you. Don't try to do it alone, because there are resources and places that you can go that can give you the help that you need.
Your peers of people that had cancer, those are the people that is going to really teach you a lot. Those are the people that you're going to turn back to, because they are your teachers. Take the knowledge of what you learn, and then always examine yourself, always see your doctors, don't miss your mammogram, don't miss your whatever appointments you have. Those are important. The word cancer itself is scary, but when you leave here, take it with you that there's help, there's hope.
Well, it's taken some time, but I'm beginning to see this life I'm living ain't all about me. At the end of the day, what you give is right back to you.